Hello, and welcome to another episode of Ask Dr. Leila, where I'm your host. And today we're going to be talking about some very important dental concerns, which is pain and when is the right time to see the dentist. First off, I want to introduce to you guys Dr. Anmol Batria, a general dentist practicing here at LHDM. Dr. Anmol, could you say how you would pronounce your university for us, please?
Hello, hola to my Spanish patients, friends and followers. So my university is pronounced Universidad CEU Cardenal Herrera, Valencia from Spain.
In 2008. I wasn't about to even try that. Where she obtained her Master of Endodontics in 2012 from the University of Valencia, Spain. She has several years of experience in conservative and general restorative dentistry, and she is professionally oriented towards preventative and minimally invasive dentistry. Welcome, Dr. Anmol.
Thank you. A million thanks for inviting me. I feel a pleasure to be in this hot seat. So I'm a little bit nervous, but I know being a good host, you're going to help it and make it smooth.
You're amazing. Can we start off by you explaining your heritage about your Spanish and Indian heritage, please?
Well, I was born and brought up in Spain, but definitely I have an Indian origin. I would say my parents moved to Spain 50 years ago. So yeah, I have both of the cultures, and I guess it sounds exotic.
Best of both worlds, I would say.
Yes, definitely.
And I see it in you. I see the Spanish part and the Indian part, and it's both amazing, and it makes you super special.
Thank you. Thank you so much.
Dr. Anu, can you please explain to our listeners what a root canal is and when is it necessary?
Certainly. Root canal treatments are procedures considered very conservative in dentistry, where the aim is to preserve and save the tooth when there is a badly damage due to a cavity or an infection in the surroundings. So instead of sacrificing and removing the tooth, we are saving it. In mundane words, is when the pulp, the heart of the tooth, is affected due to a cavity, a trauma, or any infection, we are doing our task, which is like shaping, cleaning, and sealing the canals to preserve that tooth, to offer the opportunity to the patient to save that entity.
Beautiful. Thank you for that explanation. Now let's talk about dental pain. It's a concern that many of our listeners might have. What are the common signs of dental pain, and when should someone consider visiting the dentist?
Well, it's very simple. A toothache, a nerve pain, I would say, it's like a throbbing pain, an spontaneous pain, an extreme pain, a shooting pain that even causes like extreme sensitivity, even when you touch the tooth or around the area. So definitely when this happens, the patient has to rush to us, and then we do the diagnosis and the treatment plan.
It's something that nobody likes to be in, but thank God for people like you, because they say it's, tooth pain. Some women say it's just like having labor, having, childbirth. And when you can get them out of pain like this, it's incredible. Let's discuss an essential topic, recognizing common dental symptoms. Can you share with our listeners some of the key symptoms they should be aware of that might indicate a dental issue?
Yeah, probably I will repeat myself. It's an intense and constant pain, which causes extreme sensitivity. Sometimes you can even face some discoloration in the tooth. Even some patients, they describe like a small pimple around the tooth. So yeah, that would be basically the symptoms that you face. I would give some general knowledge, which is like dental issues, they worsen often with the time. That's why whenever you detect some kind of circumstances like this, you should rush to us and let us deal with the problem. Because the most painful thing I would say in the root canal treatment is the pain that you guys are experiencing before coming to the procedure. Because as you know, during our procedure, we are using local anesthesia. So during local anesthesia, you're going to be numb. You're not going to feel anything. And our task, our procedure is very rhythm and very quiet because, in fact, the drilling, it's minimized.
Correct. Something I may add, correct me if I'm wrong, that's spontaneous pain. I always ask people, if you're just watching television or reading a book, if you have this throbbing pain and it's not sharp, it's more a throbbing, lingering. And if you get woken up at night,
Yeah, exactly.
that's when you know it's nerve, correct?
Yeah, agreed.
So before we wrap up, one common question asked by most of our patients are, what is irreversible pulpitis? Because we throw this word out to them. And how is it different from regular pulpitis?
Well, to explain pulpitis in medical terms, it's a state where the pulp, which is the heart of the tooth, let's say the soft inner tissue of the tooth, it's inflamed. So we say it's reversible when the dentist, us, we can treat it. Let's say there is a cavity and we can perform the filling. But it turns out to be reversible when it lingers, the extreme sensitivity related to cold and hot. And there is no way out. You have to come to us to get the treatment done. That would be somehow to understand the difference between reversible and irreversible.
And it's mostly to hot, correct? Not to cold.
Both.
Means
both.
Okay.
Both. Because, in a reversible pulpitis, you can have some lingering to the cold.
Mm-hmm.
But definitely once you perform the treatment, the cold stuff, it's finished. But in the reversible, it doesn't stop.
It doesn't stop.
Yeah.
And further, what are some steps to maintain good dental health and prevent these issues?
Oh,
prevention.
Leila, I will take this advantage to promote ourselves. So I will invite all the listeners to come to us for a routine checkup. As you know, we should visit the dentist twice a year, every 6 months. That's the time we get the chance to check on you guys, to proceed even with x-rays and the cleaning. But definitely you can collaborate from home. I would say remember to brush after every big meal, floss daily, maintain good habits, balanced diet, drink water, replace your tooth head of the brush every 3-4 months, maintain a good level of stress, like try to control it. Otherwise, we will end up providing you a night guard. What else we can say? Maybe I would say just rush to the clinic if you ever feel any kind of sign or symptom of sensitivity or further pain, because at the time you will regret.
Exactly. The longer you wait, the more things accrue.
Exactly.
Not only costs, but time.
It's just to avoid the excruciating pain that someone can face.
Absolutely. And for our final segment today, Dr. Anu, let's dig deeper into a specific topic. Necrosis of the tooth. What is it, and what are the implications for someone experiencing it?
See, a necrosis, I would define it as a condition where the infection of the pulp contamines the nerve and the blood vessels, and it dies. So usually we say, like, the necrosis of the pulp or the tooth, it can end up giving you some extreme pain, and if you don't treat it, it will get spread in all the surroundings, and it can cause you some discoloration, some swelling, some abscess, etc. So to avoid this, again, I'm sorry, I'm going to repeat myself. You need to visit us so we can detect this on time and avoid you to face any unbearable pain or discomfort.
Prevention.
Yes, exactly.
As we have repeated a million times. Thank you, Dr. Anmol, for providing us great insight today into recognizing common dental symptoms. And to all our listeners, thank you for tuning in again at the Ask Dr. Leila podcast. And until next time, stay safe and healthy, everyone. Thank you.